Hi, this is Josh Herbert, and this is my Brady algorithm audio recording. I'd first do an initial assessment of the patient uh, to show that patient has a bradycardic heart rate, which would be under 50 beats per minute. Then I would maintain the ABCs, airway, breathing, and circulation, assist breathing as needed, and give the patient oxygen if they should be hypoxic. I put the patient on the monitor and obtain an initial reading of the underlying rhythm as well as monitoring blood pressure. Once I get the reading, I would obtain IV access. Mind you, those first four things would all be done fairly quickly, so they wouldn't be that slow. A lot of them would be done all in conjunction with each other. If patient shouldn't, if the patient doesn't have uh, significant signs and symptoms, uh, serious signs and symptoms, then it would be just monitor and transport to the hospital and reassess every 5 minutes on the way to the hospital. But since this is about the Brady algorithm, they're going to have one of the following serious signs or symptoms: either hypotension, acute altered mental status, acute heart failure, signs and symptoms of shock, or ischemic chest pain. If any of those are present, I would immediately give 0.5 milligrams of atropine and continue to do so every 3 to 5 minutes up to a maximum dose of 3 milligrams of atropine. If the atropine doesn't stabilize the heart rate, I would go to transcutaneous pacing with the pacer pads. I would set it at heart rate of 70, and once I gain capture, I would set it 2 milliamps above the capture voltage. And should that not work and the heart's just too weak and the pacing still isn't able to keep the heart rate up where it should be, I would go to a dopamine drip. It would be between 2 and 20 micrograms per kilo per minute. But since I would want the beta effects of the dopamine, I would start the infusion between 5 and 10 mics per kilo per minute and titrate to effect. Lastly, should the dopamine not work and this patient is just very, very sick, I would start an epinephrine drip at 2 to 10 mics per minute and again titrate the epinephrine to effect. Once get the patient to the hospital, I would consult with the doctor about having a permanent pacemaker placed for the patient, and then that would be it.